Hey everyone, my name is William Humphrey. I'm one of the Western Michigan Family Medicine residents. Today I wanted to just take the opportunity to talk to you about our OB curriculum. I think we have some very unique features, including the fact that we have our own OB service, which means that we take our moms all the way from their initial prenatal visit and follow them throughout their course, all the way up to delivery and through their postpartum period. We get to take care of the babies afterwards, and it provides a really nice continuity. We also have an MCC clinic, which basically is an opportunity for the interns to focus on obstetrics for 2 months out of their intern year, both inpatient and outpatient, which allows them really to get a solid foundation. We have a wonderful faculty who are really engaged and really enjoy teaching, and really like to spend the extra time, especially in the obstetrics. I hope this gives you a little bit more information about our obstetrics part of our program. We look forward to meeting you all.
Here at Western Michigan University, you have multiple opportunities to interact with the pediatric community. You will do multiple rotations on inpatient pediatrics and working in the largest pediatric ward in southwestern Michigan. You will work alongside both pediatric and med-peds residents while striving to further care for a wide range of ages, including newborns up through adolescence into adulthood. You will also have opportunities to work on pediatric clinic rotations, where you will focus solely on the pediatric and adolescent population, working alongside attendings and specialists in that field. In our own current family health center and the clinic you will be working in, you will have continuity care through all different ages, including pediatric and adolescents. Most often, it makes up 15 to 20% of the total volume of patients you will see over the course of your 3 years of practice. With that, you will help establish continuity of care with patients and take care of them through their developmental milestones. We offer many electives focusing on pediatrics, ranging from adolescent medicine to developmental behavioral health and sports medicine. There are many opportunities for you to explore and enjoy the wide, vast range of pediatric medicine.
Hi, my name is Mohammed Asif. I'm one of the residents here at WMed Family Medicine in Kalamazoo. I wanted to take a minute and just talk about our inpatient family medicine service. It is very much a resident-owned service, which we cover 24/7 here at Bronson Hospital. The service is led usually by a PGY3 Chief of Service, and we staff and review our patients with our very own family medicine faculty each day. The supervising attendings are the same as those in our outpatient clinic, so it really makes for a very seamless experience into the hospital. One of the best parts of being a family physician is the continuity of care, and we really indulge in this philosophy since we admit all of our very own patients into the hospital, and because so much of our population has many socioeconomic challenges, we see very advanced chronic conditions. And we see very severely exacerbated acute conditions, which sets the stage for excellent learning opportunities as a resident. In addition, we also admit non-continuity patients directly from the ER, and this just adds that much more variety to the pathology we are able to manage. Kalamazoo receives a lot of really sick patients from many surrounding smaller medical centers in the entire southwest Michigan, provides great exposure and clinical experience. And I think we do a really good job of making the most of this opportunity by doing regular teaching talks, whether that be at lunch or in between rounds. We have very academic style rounding. In addition, we often have medical students or pharmacy students that rotate with us, and it helps provide this really good dynamic of learning but also teaching, which are both really important skill sets in medicine. It is certainly one of our most demanding rotations, which we work through 2 to 3 times each residency year. But each time you grow and accordingly earn that much more responsibility. That change happens very quickly in your first year. I think at the end of your first year, all residents are pretty amazed at how far they've come, and you probably still feel pretty nervous at the start of your second year. You will, however, have the knowledge and experience to manage the service by yourself overnight. Of course, if you ever need it, help and support is never too far. While the service is usually rather busy, I think it's one of our most fun rotations. The high intensity and acuity results in your clinical aptitude growing so quickly, and you can really feel the difference between the start and the end of each block. Plus, since it's all of our family medicine residents, you really get to bond with your co-residents, and we get to share a lot of laughs, and a lot of our inside jokes start out there. So it's just a really fun place and service to be on.
Hi friends, I am Hera Khan and I am a resident physician here at WMed. I would like to talk a little bit today about ambulatory medicine part of our program and what makes the family medicine residency at Western Michigan University in Kalamazoo so unique. So we practice out of a federally qualified health center, and so a lot of the patients that we see are socioeconomically disadvantaged. Now, this is a great learning opportunity for our residents because we get to see so much pathology like congestive heart failure and diabetes in a relatively younger population. These are the same patients that we admit to our family medicine inpatient service. Our faculty also maintains specialty clinics in transgender healthcare, which includes hormone therapy for gender transitioning, PrEP prophylaxis, pre-exposure HIV prophylaxis, and routine health maintenance and preventative exams. We also have addiction medicine as well as obesity medicine, which entails medically managed weight loss clinic as well as osteopathic manipulative medicine within the residency, a continuity clinic. The Family Health Center itself is an absolutely beautiful clinic. We have our designated Team Oakland, which is where all of the residents work. We have a ton of resources also available at our disposal at the Family Health Center. Now, this includes pharmacists, social workers, care coordinators, psychologists, in-house physical therapy staff, our wonderful faculty attendings, and our incredibly knowledgeable and hardworking MA staff. We, the residents, receive full training in all aspects of women's health, including comprehensive reproductive health training, contraceptive management, and education. We also get to do a lot of procedures like colposcopies, placements of IUDs, as well as contraceptive implants.